Hi, everyone. Today, we're going to talk about the different types of communication. First, before we start on that, let's just back up and refresh what therapeutic communication is. If you remember, therapeutic communication is the interaction that takes place between the provider and the client. It enhances both the physical and emotional needs of the client. These are communication strategies that are used to support a patient's feeling of well-being. So the goals of therapeutic communication is one of them is to help a patient feel cared for and understood. And it's also to establish a relationship or a rapport with that patient. So by achieving therapeutic communication, we help the patient to feel free to express his or her concerns or their issues or any of their worries or stresses. So in order for us to achieve it, though, we need to be aware of the different types of communication. So there are basically three types. There's verbal, there's nonverbal, and there's written. But today we're going to focus on verbal and nonverbal. All right, verbal communication. Well, this refers to the type of communication where we share information by using spoken words. However, words don't matter if we don't understand the message. And here's what I mean by that. Have you ever had a time where you were, maybe you were out at a restaurant or something and you overheard a conversation and the conversation was in a foreign language and you didn't understand them? So you could hear the words, but you couldn't understand the message because you didn't understand the language. So words are only as good as how we are delivering that message. So to be effective, communication also has to have meaning. If we don't understand the words, then the communication is lost. In order to accomplish this, we practice what's called the 5 C's of communication. And those 5 C's are complete, clear, concise, cohesive, and courteous. So let's talk about those just a little bit further. First, complete. Well, messages need to have all the necessary information. Not only that, but we want them to not be misleading. Clear. Clear is how we present information in terms so that everyone that's involved in the conversation can understand those terms. We wouldn't talk with a patient using medical terminology or medical jargon, right? If we're talking to a patient, remember, we want to break those terms down into layman's terms so that they can understand. Another thing to consider is we want to make sure that we enunciate carefully, that we're pronouncing words appropriately, and that we're using good diction. What happens if we're not doing that? People get so caught up in how we are not pronouncing words correctly that they completely miss the message. You also want to keep objects out and away from your mouth. For example, gum and candy. Have you ever talked to someone who they're having a conversation with you? Maybe they're even doing a presentation and they have a piece of gum in their mouth and they're constantly chewing that gum or popping it all the time. What happens is it's a huge distraction and we start focusing on the gum that we are not hearing what they're saying. We also want to keep background noises to a minimum. And there's a couple of reasons for that. One, we just talked about distractions, and background noises can definitely be a distraction, especially if we're talking to someone who's very auditory. Another reason for that is if someone has a hearing impairment, then those background noises is going to keep them from hearing what it is that we're saying. We want to be concise. So when you're talking with someone, you want to be sure that you're not including unnecessary information. Don't be wordy, be direct, keep it simple, and be to the point. We don't want to get so caught up in the story that we miss the point of the message. And then cohesive. Ensure what you're saying is logical, that it follows in order. You don't want to jump abruptly from one subject to another. You want to transition nicely, okay? And also, when we're talking about being logical and following in order, what if we're giving a patient instructions on something? And we want to make sure those instructions follow step by step. If not, they can be very confusing. And it's the same way with talking with someone with communication. And then last here is courteous. Remember, we just talked about what our goal is for therapeutic communication. Our goal is to have our patient feel comfortable with us, that they can open up and talk with us. They can tell us their problems. They can talk about their concerns. They can let us know what they're worried about. So how can we make sure that the patient can confide in us and that they're comfortable? Simply by being courteous with them. You know, if you have ever talked to someone, maybe it was a healthcare professional, maybe you were a patient, or maybe it was in a store, maybe it was somewhere that a staff member or a healthcare professional was rude to you. What did that do to the communication cycle? Okay, what happens is if we're not courteous and we're rude, then the communication is lost because we have a tendency to put up those defense mechanisms and we just simply don't want to talk anymore. So that's verbal communication. Let's talk about now nonverbal communication. And nonverbal communication is a type of communication that's shared without spoken words. We learn this language first. Think about it. Let's talk about infants. Let's think about babies. Babies learn at a very early age that if someone smiles at them, then they smile back. Or if they're upset about something or they're hurting, a simple touch will comfort them. So nonverbal communication is our primary type of communication. It makes up 70% of the total communication. 23% is our tone of voice, and then only 7% is what is actually said. Only 7% are the words. So we have to be very mindful of that nonverbal communication, because if they don't match, then we lose everything. We unknowingly use this type of communication. Much of our nonverbal communication is a learned behavior. It's greatly influenced by our culture. Let's talk about eye contact, for example. In American culture, eye contact is not only acceptable, it's expected because it does a couple of things. One, it shows respect, and two, it gains trust. However, that's not true in all cultures. In some cultures, in fact, eye contact is actually considered disrespectful. So we need to be mindful of that as well. And this is our truest form of communication. It's something that we naturally express. Have you ever had someone that said, man, what's wrong with you? You know, I could see it all over your face. You're like, what are you talking about? We may not always realize the message that we're sending. So these negative messages could be completely unintentional. However, what we need to keep in mind is, even though they are intentional, because they are expressed, they still affect our message. So we need to be very cognizant of that as well. Our feelings are greatly communicated nonverbally. So keep these things in mind. There must be congruency between verbal and nonverbal expressed messages. So what I mean by that is what we say must match what we show or what we're presenting, okay? Nonverbal cues appear in groups. So you might have just a single nonverbal cue, or you might have a group of them, which is called clustering. So for example, if someone is angry, they may have clenched fists, their tone of voice may drop down, might get a little sterner, their facial expressions are going to change. So those are three different gestures or three forms of nonverbal communication, and that is called clustering. So what are some different types of nonverbal communication? First, we have to talk about facial expressions, right? Now, we have to know, though, that eye contact and your eyebrow movement are all part of that facial expression, okay? And this is the most important type of nonverbal communication. So let's go back. We already talked about eye contact. So let's talk about eyebrow movement. Well, what do I mean by that? Well, if you kind of clench your eyebrows together, that can mean I'm angry, I'm upset. It could mean I'm confused. Or if you widen them, it means I'm excited. So be mindful of what your face is wearing as well. Touch. Touch is the most sensitive form of nonverbal communication. It shows reassurance, it shows understanding, and it shows that you care. If you take a look here down in this lower right-hand corner, you can see the healthcare professional here. She is simply touching the hand and touching the shoulder of the patient. How do you think that made the patient feel? Do you think that the patient possibly feels like this healthcare professional is concerned about her? Maybe it gains trust as well. So touch is very important, but we also need to be sure that the patient's comfortable with touching, okay? And personal space. Personal space is the distance between individuals. And this is going to be determined how someone has been raised socially, or maybe what's culturally acceptable for them. If you're too close, someone can become very uncomfortable. Maybe they will feel threatened. But at the same time, if you're too far, it may make you appear like you're hurried or that you do not care. So you need to find a really healthy balance there. And position. This kind of goes hand in hand with what we were just talking about. We want to maintain a close position, but still be comfortable. And this needs to be for both you and also the patient. So if you are talking with someone and you kind of go a step closer to them and you notice that they kind of step back just a little bit, that's how you know, maybe, okay, I've kind of invaded their space just a little bit. I'm going to stand back here a little bit. But something else to consider, not just about being close, but also your position with them includes standing over them. Have you ever been a patient where you're sitting there and maybe the healthcare professional is standing there talking to you and they're standing up and you feel like they're kind of standing over you? Well, how did that make you feel? Well, what it does is it indicates superiority for the one that's standing. So the one that's sitting may feel like they're inferior. They may feel intimidated. Okay. And then back to being too far. If we're too far from someone, it may seem like we're trying to be avoiding. Maybe we don't like them, or we're just simply not interested in them. So that's what that implies. We want to kind of lean towards the patient some. If you look in this picture here, you can see she's leaning in towards the patient. She's kind of touching the patient's arm. Maybe it's the patient's shoulder. But how do you think that's making this patient feel? What it does is it indicates warmth. It gains trust. And it says, hey, you're accepted. I'm here to support you. Posture is also really important. When we're talking about posture, obviously we're talking about how we stand, how our shoulders are. If we're keeping our shoulders back, it makes us appear confident. And if we show confidence, then our patients will feel like we are competent and that we can take care of them. However, slumped shoulders can seem like we're discouraged. Okay, let's talk about some arms folding. You've seen where people have had their arms crossed. Well, what does this imply? Well, it implies avoidance, okay? Something else I want to bring up is when we're talking about these forms or these types of nonverbal communication, it's not just about us being the presenter or the sender. We also need to watch our patient. So if they are sitting there with slumped shoulders, this could mean they're depressed. It could mean they're in pain. It could mean they're discouraged. So we want to watch for these signals, because if we notice these things, we really want to kind of do some questioning techniques to kind of find out what's going on. Gestures and mannerisms. That's something else that's pretty important. Talking with your hands. I do it all the time, and that's okay. However, we want to make sure that we're not doing too much talking with our hands, because if we do too much, it can be distracting, and then all of a sudden they're not paying attention to what we're saying because they're watching what our hands are doing. It can actually be helpful, though, because it can emphasize ideas. It can also hold someone's attention, okay? You want to avoid finger tapping. Have you ever been sitting there talking to someone and this is what's happening through the conversation? It's pretty distracting, right? It's kind of pet peeves for some people. Something else too, and I'm guilty of this one, this is why I'm going to bring it up, is the same thing with the clicking of the pen. Okay, these are all things that people find to be incredibly distracting. Okay, we want to avoid shrugging our shoulders. We want to not fidget. If we fidget, it makes us appear anxious and nervous. Clenched fists. So all of these things denote negative feelings, okay, like anger with the clenched fist, or like we were talking about, impatience, or just plain rudeness. So when we're talking about nonverbal communication, we have to bring up listening skills, okay? Effective listening requires concentration. We need to focus on what's being said, but we also need to focus on what is not being said. That's where these nonverbal communication skills come in. We want to observe the body language of the patient, watch their facial expressions. If we're asking them, well, how are you doing today, Miss Smith? Well, I'm doing all right. Is she really doing okay? This is when we would want to peel that onion back just a little bit further so that we can kind of find out what's really going on with Miss Smith. Be attentive. Look at the patient when you're talking to them. Okay, you don't want to be looking over to the side. You don't want to take out your cell phone or decide that there's something else that you want to see. Give them your undivided attention and look at them. Remember, we talked about that eye contact and how that eye contact gains trust. Remember, we talked about that? It also gains respect as well. So to confirm your understanding, when I talk about confirming your understanding, I'm talking about if the patient is telling you, this is how I'm feeling today, or they're telling you something, and you want to demonstrate to them that I, in fact, was listening to you, and here is what I heard you say. We can use paraphrasing. And paraphrasing isn't exactly restating what the patient says. Paraphrasing is taking what they say and using our own words and then replying back to them. And this does a couple of different things. One, it lets them know we heard them, we were listening to them, and we understand them. Two, what it could also do is maybe we didn't get the message right, and it lets the patient know that, and so then they can reword what they were saying and go, no, that's not exactly what I meant. What I meant was, and then it keeps us from being confused and to make sure we're all on the same page. The greatest barrier to effective communication is not listening. Not listening. And some of the things we're kind of guilty of, and I've been guilty of it myself, is when someone is talking with us, we're thinking of something else. It's really easy to do. Maybe you're sitting there talking to someone and you're going, you know what am I going to cook for dinner tonight? Or, man, I really need to work on that project. So we're not really listening to them. Something else that we can be guilty of, I have done this, and it's something that I work on for myself, is when someone is talking with me, sometimes we can sit there and try and formulate our response in our head. So now we're not listening to what they're saying because we're trying to concentrate on how we're going to respond to them. Next is distractions. And look here, I put cell phone up. These cell phones are wonderful, but they are very big distractions. I'm sure you have talked to people at some point. Maybe it was your children, your significant other. Maybe you were in a doctor's office as a patient. And as you're sitting there talking and they're looking at your cell phone and they're like, yeah, did you hear what I said? Are you listening to me? So we want to make sure that we keep that over to the side, avoid any distractions, and give them your undivided attention. And then we talked about paraphrasing, right? And sometimes when listening, our best response is simply silence. Sometimes patients just need someone to talk to, someone that's going to listen to them. Remember, they're going through a lot of very stressful situations, and they may not have someone that they can talk with. At the same time, maybe they do have someone that they can talk with, but they're just not comfortable, or they don't want to burden their family members with their concerns. So that's what we are there for, is to listen to them. So in these instances, what we can do is just simply acknowledge them so that they know that we heard them and we were listening to them, offer our reassurance, okay, and then offer our support. So some final thoughts. Communication has always been and will always be the basis of any therapeutic relationship. These skills take practice, review, correction in order for us to improve. Remember, communication skills are in fact skills. And how do you get better at anything? By practicing. So we may not be perfect. You're never going to be perfect in that respect, but we always have opportunities for improvement. Okay, so our goal is to always strive to be better, always work towards that improvement. How do we do that? Well, we do that by practicing these techniques. Practice them every day. You can start right now. Practice with your family members, practice with your children or your significant other. And what I'd like you to do, I challenge you to this, as you are practicing these, I want you to make note of something. I want you to compare how the communication was before you did these skills, and then compare them to how they are now after you've practiced these skills. Compare how your relationship has improved. How has the communication improved? How has the rapport improved? I bet what you'll find is all of them have improved. Well, thank you for joining me today. Until next time, take care.